about not just any person. This is part of the knowledge economy that we have. Professionals of high repute, from the level of consultants to the chief registrars and all of them, even the registered nurses and midwives. Some of them almost at the height of their careers. They are moving. Even the ones that are still training now, you can never know. They have the plans of moving as well. So what can we do? By the way, we must recognize and identify how we got here so that we can provide solutions to these issues, because this is what this program is for. Having conversations that has to do with the betterment of this great nation called Nigeria. So yesterday, I think at 2 days ago rather, at the budget defense at the National Assembly, you'll recall that the budget defense is on for MDs of the government as well. So chief medical directors of health institutions were there 2 days ago, and so they told the members of the House of Representatives and informed them that Nigeria is facing the risk of dealing with hospitals without doctors and nurses and other skilled health workers within the next 2 years. And so the chief medical director, CMDs of teaching hospitals, raised the alarm, at that meeting. At the House Committee on Health Sessions, chaired by Mr. Patrick Umar, that's the House Committee chairman, and they noted that despite the federal government's investment in health infrastructure, tertiary health hospitals were facing threats of becoming empty. That's quite big, empty, as their workers had been living in droves due to uninspiring remuneration and poor pay packages. So the chief medical director, CMD of Lagos University Teaching Hospital, LUTH, Professor Wasiu Adeyemo, and the CMD of University College Hospital, UCH Ibadan, Professor Jesse Abiodun, they were in attendance at the Pali on Monday. And Adeyemo called on the authorities to act fast to address the situation. And let me quote him. He said, people retire, not even retirement now. Resignation almost every day. In the next 1 or 2 years, we are going to have all our hospitals empty. We need to do something about the remuneration of all healthcare workers. Otherwise, the government is putting a lot of money into infrastructure, and we are going to have empty hospitals. The major reason why people leave is for economic reasons. Consultants are earning less than $1,000, and we have a former chairman of the Nigerian Medical Association, the Ocean Wing, with us, Dr. Adedapo Adetoye, joins us virtually. Thank you for joining us, Doctor.
Thank you. Good morning, Femi. Good morning, Nigerians.
Thank you very much. Your colleagues, medical doctors like yourself, by this about the decade of the CMDs, they are complaining, that of LUTH, that of UCH, possibly on behalf of the other CMDs, to say Nigerians, senators, House of Rep members, government at all levels, there is a problem. And if we don't take care of it, in less than 2 years, we'll be having empty hospitals. Dr. Adetoye, are they exaggerating, or you agree with them as the true position of things in our country?
Thank you very much once again.
You're welcome.
I think being the CMDs are in political offices, despite the fact that they are very astute professionals who are at the peak of their careers, so they will make things seem a bit less than what they have, because they are supposed to be standing in for government in those teaching hospitals. But I can tell you that in some teaching hospitals, things are even worse. For example, in UTC where I work, it's even worse than that, because we've not been granted, the hospital has not been granted waiver to employ for the past 2 or 3 years, if I'm not mistaken, because of certain events. Even these hospitals that are complaining, UCH, LUTH, they have been employing almost every year. Since all the UCH adverts late last year, and they employ some people, because even there's internal jackpot. Some people migrated from our own hospital, especially those who were employed then, and they were not paid because there was no proper waiver. They moved over to UCH and some of these institutions. So our own loss was even their gain. So giving insight into the situation of where UTC live now, for example, Though I'm not the spokesperson of the hospital, but I'm just telling you facts because by the virtue of my privileged position, I had knowledge. It's even going to be worse. And if you look at it, if we don't know our history, we may not know where we are and may not be able to forge ahead. The government is saying that they've invested so much in medical infrastructure. Well, that may be. They are at the end of affairs. They know what is going on more than we do. And I read the news truly too. And even at that presentation, the CMDs were complaining that their capital budget was not released. That even up to some of them were released, that the usage was quoted that the data of usage was released around December last year, up to 38% of the capital budget. That it was only the personnel budget that performed up to like 90-something%. I read all those details. So if the capital budget was released up to 38%, so where's the investment that we are talking about? So let's come to the personnel. Out of the three factors, the major factors of production, man, machine, and money. The most important one seems to be the man. Because it's very dynamic, it's interacting with the environment, is the one who manipulates the other ones. And that's why we are seeing what we are seeing now. Thank you very much for quoting it that a consultant in Nigeria earns less than $1,000 because of the state of our currency. Whereas where people are running to, they earn about $6,000-$7,000 in a month. Even some more than that, if you can put in more. And an average Nigerian consultant is putting in more than that because so many people are left. Instead of us to collapse the system a bit so that you don't overwork the ones on ground, you are overworking them. See, they are not getting the pay. Some of them are even no longer relevant to their families because they have to stay around for sentiment reasons. And all over the world, any economy that will develop will be devoid of such sentiment as we are doing humanitarian job and the likes. Start from the scratch, even from the education level. To get into the university to study medicine is about the most dreaded thing now. You know, is in terms of the score, what the child has to go through. So many children who applied for medicine and scored very good marks will not be admitted into the university because they chose medicine. And nobody is saying that. Even at the point of entry, if you look at the private institutions that we have around, how much they are charging to train students for medicine, just the school fee alone. Like, I don't want to mention institutions now, but you hear things like 6 million, 7 million naira per session. And that will be, increasing every session. We are not talking about the maintenance for the child and all those things. Talking about books and so many other things. We know it's capital intensive. Even those places where doctors and nurses and all the health workers are running to, that's what is happening to them too. Their own people stopped studying those courses because it's capital intensive and most likely they feel they can go into some other fields and get the money. So why are you having the title and you can't even, you can't shake body small. So it's embarrassing. And what is the response of the government to that? These are facts and figures that should be attended to. All the government will need to do is try to do something close to what the people are pursuing elsewhere. If you say the grass is greener somewhere else, make the grass here green, even if it's not greener, so that it will be a bit comparable. And then the people can stay. But instead of that, we get a lot of threats, at the regulatory body level, not threatening people, House of Assembly coming together to say people must serve for 5 years. Is that what you do to people who study Yoruba, who study mass comm and some other things? Why is it these people? Instead of you to do the right thing, when you need, I keep saying it everywhere, when someone is needed, when you need the skills of a particular person, you may have bricklayers along your street who are doing well, but you want to build your hotel and you want a particular class. You go to Lagos and bring other bricklayers who have done such work before, and you pay them extra, you pay them beautifully. So the issue of government coming up to come and say you are civil servants and there is one table somewhere will not work. This is a matter of contract. Nobody knows how long he or she will live for. And these are people their families have invested on. Their parents have sold houses, sold so many things. Even some of them, they are the only one who became educated in their family. Their younger ones had to stop schooling because of them. and they will not come out and become useless to the community that made them in the name of being patriotic. Is that what the politicians are doing? As the president started riding on a Corolla car because he wants to be patriotic, as the governor started doing that. So to be factual, like you said, the economic aspect of it has to be looked into. The people have to be properly placed to retain their services within the system. And then you can look into whether they are doing enough work or not, which is, they are even doing more than enough. People are breaking down. And that is the incentive. That's why people are moving over the more to areas where they could serve, get properly paid, be encouraged, have enough equipment to work with, get fulfillment when they are still active. So those are the issues. The government should look into these things and make sure that things are okay. You can easily take the price of 1 liter of fuel from less than 200 naira to over 1,000 naira. But nobody's salary has increased astronomically. And these people, they don't know how to plant cocoa. They are not, even if they want to, they are not going to do that today and start reaping tomorrow. So there are certain parts of the economy that are actually rewarding to some people, but when it is not paying you.
All right, we'll try and reconnect with Dr. Adetoye because he's dropping bars,
right?
As they say, to lay a foundation that this is how we got here. And you know, some of these things that attract other persons, you know, from outside the country, the greener pasture, so to speak, because it's not that they go there and then they go to hospitals, they attend to one patient and then they lazy around. No. When you speak to them, they will tell you, you walk your socks off, actually. But then, you know, there is value for your work. You are adequately remunerated. And these are the things that people want to say. Nigerian doctors will say, all right, we understand Dr. Adetoye is back. Can you hear us, sir?
Yes, I can hear you clearly.
All right, you are going to land on your thought.
Yeah.
Okay. You are making a point.
Yeah. I know. I was just saying that look, the government should categorize these people as special in their own way. If you still keep saying this is civil service and this is how much we are going to pay you, when his colleagues are earning like ×7 or what is earning, and they are going to face the same market, the same challenges everywhere, they are bound to move his contracts. You know, overseas where people are going to, you have your timing at work, you will do that work, you have your time for rest, but here you practically have no time for rest. See, you have nothing to show. In fact, most of the children, there was a survey recently, most of the children of doctors in Nigeria are not willing to study medicine. Because even those who study medicine, when you ask them, are you going to become a specialist? He says no. A lot of things militating against doctors in Nigeria, even those ones who went into academics. Now, after doing so many years of training to become specialists, now the universities are saying, if you don't have a PhD, so they have to go and apply for PhD now at old age to be able to become a professor. Even some professors are better than the others as we stand now. Because if you're a professor of medicine and you don't have a PhD, some universities will refuse you applying to become the vice chancellor of them. Are you saying one professor is better than the other? Even when those ones have more papers, more quality papers than the ones who are then becoming the vice chancellor. So a lot of battering from here and there. If you are a lecturer and you are a medical doctor, you are a clinical lecturer, you are going to earn less than your senior registrar that you are training, just because you subscribe to training other people. So it's not only the university, it's not only the teaching hospitals, even the universities will be empty in some aspects very soon. Because even if you advertise, nobody will apply because it's not encouraging. Some of us went this way and this far because we saw our senior colleagues, we loved their way of life, and that's why we sacrificed so much. I'm persuaded that people to also become, I'm undergoing this. By the time I'm through, this is what is expected of me and I'll be able to do this. And now you're getting to a point where you are supposed to be giving back to the system. Not just the public system now, even your own home. And you will now come up with complaints that look at what my pay packet is. You can't even ride a good car. You can't pay school fees. It's embarrassing. And that's why the people are leaving. And I'm not, if the government does not change their policies, well, I don't want to be a prophet of doom.
Okay, and you have said enough with that. We have so many layers to unpack this morning. You made mention of something. You said apart from the JACPA, the abroad JACPA, there is internal JACPA as well, and we'd like to look into that. This JACPA, from where to where, you talked about, okay, maybe from a teaching hospital to another teaching hospitals, and you talked about even training, because this morning in our papers we learned the UCH students are complaining and not complaining, they are protesting 82 days of blackout at UCH. And so I was just bantering with my colleague that what kind and quality of training are they supposed to earn under darkness? 82 days. That is one. Now you talked, and I want you to note that as well, the quality of the doctors that are even being trained. The example is what we have with UCH students now. 82 days, they've not had light. Some, what do you call them now? Patients are complaining. In fact, around October, September, and it's the turn of the medical students now to be complaining. That's one. Number two, the internal JACPA thing. From where to where? Is it from the public institutions to private institutions? The grass that people are saying is not green enough in Nigeria, that is taking them abroad. How come that grass is greener from a public facility to a private facility, or is it from private facility to public facility? Is the grass green in anywhere in Nigeria, medically speaking?
Okay, let me put it this way. There's also internal JACPA. I mentioned one when I was speaking earlier on, when one institution is not doing well and the other one is doing well. Even in the northern part of Nigeria, some institutions are also trying their best, relatively, and the environment is a bit conducive. So people might migrate there as well. But even people are resigning from federal jobs, federal teaching hospitals, federal medical centers, and going to big private hospitals in Abuja, in Lagos, and some other places. Because of the juicy offer they give them. Imagine if a private hospital could offer good money, there's a stated duration of work for you. You are not the only one. You don't have to work yourself out. They've already stipulated it because they don't want you to break down so that you can keep serving them. Comes with a package. You have your time for leave, and they're also telling you can go for two seminars or two conferences in a year, sponsored by that institution in a year. In fact, there are some hospitals in Nigeria who even offer the doctor, get him a house, like in Abuja and Lagos, up to 100 million naira, and you pay back over. Where would that doctor go? If you want to go for further studies that will enhance their job there, they will allow him and sponsor him. So there's also internal JACPA. I was calling somebody some time ago, thinking he was still in one federal medical center. And he told me, no, chief, I've left that place. I'm now in one private hospital somewhere, and they are doing well. So those things are there. Even the medical students, see these medical students now, who has not had light within UCH for 82 days. So he would then finish his training, complete his training. I asked him to stay there to do his job. What will he tell you? You can look for somewhere else where things are better. He wants to live a better life. That's why he's sacrificing all this. And for those 82 days, it is the grid or the hospital that didn't supply power, an alternative power, source. I'm sure those students will find a way around it. Their lecturers will try to lecture them. We either have a Zoom or this and that, those things that involve physical activity. Maybe they'll contribute money, buy some petrol into gen, and then maybe even contribute money and buy a small gen for that process. And all those things add to the cost of training as well. So those are the issues. If the environment is not conducive, if it is not appealing, those who are ahead of you, if they are not seeing something good in their lifestyle and the way they are running their lives, out of this token that they are being paid, the mega sum, and you are still contributing to buy generator, to buy fuel, just to make things work. It's sad. And those are the challenges. Okay. If we don't look into all these and solve them, there is a problem.
Doctor, when you were speaking earlier, you talked about collapsing the system a bit. You said the government should collapse the system a bit. How should that collapse be done, Doctor?
Okay, let me give an example. If you have, for instance, on a ward, there's a ratio of nurses to patients that should be on that ward. Let me use my own word. I'm an anesthesiologist and an intensivist by training. In the intensive care unit, there should be one nurse to one patient per shift. That means in a day, we should have 3 nurses to one bed per day. And there should be an extra nurse, one nurse, standby on that roster in case any of them breaks down for that shift. And there should be one person also coordinating. That means per shift, if you have 6 bedded ICU, you should have per shift, you should have 7 nurses plus 1. That's 8 per shift times 3. That's about 24 minimum. We are not talking about those who have to go on leave, whether maternity leave or annual leave, or those who go on terminal leave because they want to retire. But now, if you are having if you don't have that number, you are having like half of that number. The right thing to do to make things work is to just reduce the number of beds on that ward so that they'll be able to deliver and then not break down. So if you still retain the same number of beds and you are filling them up and you have 1/3 of the number or 1/4 of the number of nurses that should be there, that means one nurse will be caring for like 2-3 patients, and that will be inadequate. The patient won't get the best. The nurse will quickly break down. Those things will happen. So if we have big wards all over the place and we don't have enough personnel, let's collapse them. Let's bring the male surgical and the male medical ward together and then limit the number of beds. If we fill this number, these people can still fulfill this safely. Or else they will break down and then take sick leave. And then the number will reduce the more. The people on ground will be overworked the more, and they too will break down. Or be looking for a way out.
Okay, Doctor.
This is too much for me. I can't bear it.
All right, Doctor. When this JAPA syndrome started, I'm sure most of us in the health sector, we noticed this before it became so incessant and became so troublesome. If I should use that word, what exactly initiated this problem at the start? I mean, I know that we have the inflation at a very high rise right now, or from last year into this year. But before that, what actually initiated? Was it also the poor remuneration that started this JAPA syndrome? And what did the health sector or the doctors in charge or the offices or officials do about this when this whole JAPA syndrome started?
Well, initially it was multifaceted. People have always been moving. But one thing is, it wasn't significant. That was why people were not talking about it. It's not only the doctors. Anybody at all, you can move from this nation, even if the economy of the nation was good, you may choose to go and practice elsewhere, whether for a short time and then return to your country. Even if they are offering more there, you could go there and then benefit from the offers and then bring it back to your nation. So JAPA had always been beneficial and it had always been there, but not in this dimension, because the system was still a bit stable. There were more people in the system, but along the line, the economy went down gradually to the extent that some state governments were holding their workers altogether for several months. And when that happened, then the eyes of the people now opened to the fact that they could get something better elsewhere. And they started moving one after the other. And that was where we started from. And that was where the whole thing started from. And along the line, it was becoming worse by the day. This policy somersault as well, like the one I told you in the university and all the likes. When I graduated, I wanted to be a consultant because I saw the consultants, the way they were conducting themselves, the way they were handling things, and their expertise. I also wish I could acquire some skills and be able to practice at that level. And that was one long. But now, even the younger ones looking at things, they are not seeing hope in the future of what they chose, and they've invested so much in. In fact, so many of them have regrets that, look, they should have gone into some other things. You will agree with me that some other professionals are even doing better than those who are in the health sector within the Nigerian space. But they saw this before they chose a pathway, and they could have been committed if the gradient was not much. Coronavirus now worsened the whole scenario. Some other nations who had been doing well, they became overwhelmed and they needed hands. Even nations that were initially discriminatory, that would say, you trained in Nigeria, so most likely we can't trust your argument, started trying out doctors from other sources, and they found out that they are beautifully trained, that they have the skills and the argument, and they started employing them and asking for more. And that was when we had started warning the Nigerian government that, look, this is the trend, this is what is happening. Let's do something about it. But the people felt, no, somebody said then that we have enough so we can export. Okay, it got to a time they didn't have enough again. It got to a time they have so less and they have to be threatening people. You know what? It was in the news sometime that they weren't willing to renew the license of those who were abroad. Who does that? You are now instigating some colleges and some places of training not to inflate the cost of transcript, because you know the people will need it. When they want one clearance or the other to present over there, you now inflated the cost so much. That is not the way to encourage the people. You now see some chief executives refusing to write letter of experience for people. Okay, if somebody had worked somewhere with you and has been dedicated for so long, he says, I want a letter of experience. It sees us our rights, no matter what he or she wants to do with it. It depends on the way you now ask, what do you need it for? Hope you are not leaving us. Please, even if you leave, return after acquiring skill or something. Not that you now block the fellow and you think that's the way to do. People didn't go to school, I thought they are leaving. So you don't need to study medicine to be able to leave the shores of this country. If your papers are right and you do the right things, you will get out of this country. And some other people are also coming into our own country because there's fortune here for them as well. So people should not go that way. The people in government should not go the malice way. You know, that's what they are doing. Trying to shoot people down and then trying to oppress them and repress them. Even sometimes when the people are asking for their right, they say, no, don't pay them that amount because they will use it to japa. What is your business with that? There are some people who will not japa. They've been japaing and I'm still here in Nigeria. So many professionals are still here in Nigeria for reasons best known to each of us. There are some people, no matter what is happening, they will not japa. That is them. And there are some people that, look, they are not even seeing anything around here. So they want to leave. Okay, for example now, an institution that has not been granted waiver for almost 3 years. Those people who would have done residency training there and all those things, what do you expect them to do? To be waiting for the country, to go and sit down at home and be feeding from their mother's pots? Of course not. They will have to move elsewhere, even if it is another African country, to get a job. That is what is happening in every field, not just in the field of medicine. People have invested. They paid so much to train their children. You want those children to go and sit in their homes and be looking at the faces of their parents? Of course not. They will have to go to where the jobs are available and they can have opportunities. So those are the things. If you look around now, so many governments are trying to renovate even the primary healthcare system and the likes. That is beautiful. They are trying their best. But where are the personnel to man those places? It is not just the colorful building. So even if you vote so much for capital projects and you don't integrate them properly, there is no human being to work on them. I don't think even the robot will not work alone most times. Somebody will have to program it. So those are the issues. It should be looked into. Okay. And when these are done, I can assure you more people will even come back to Nigeria.
Okay, so Doctor, while you were speaking earlier, you talked about unemployment, sort of. You said, like your hospital, you've not been able to employ people for a while now. So could that be also part of the problem we're experiencing?
Yes. You know, that's what I'm saying. That is part of the problem. I know a little about how they process it at the federal level. You know, you need waiver from so many parastatals, almost like 9 or so. And when you get those waivers, because somebody is going to pay, somebody will put them on the IPPI's platform so that they can get paid, somebody will give the approval, all sorts of offices. So if you can't go through all this, for whatever reasons, then you cannot employ anybody because you are not the one to pay. So now talk of even the state governments. How many people are they employed? There's an arm of our association that is under the state. How many people are left there? I don't want to go into that now. That shows if they have been employing along that line, then the people should not be depleted. That system should not be depleted. And those are the people who man the primary and secondary levels of health services. We are even talking about tertiary now. We have not started talking about secondary level. How many general hospitals did you get to that you find a doctor?
A doctor, if I'm important, sir. Yes, and that's my next line of question, because we have been talking about tertiary, UCH and UBTH and OAUTHC and all of them, ABUTH and all of those. How? Because you are not just a doctor, you have been at the labor angle for some time. The labor movement, the comrade thing as an NMA chairman at some point, and I'm sure you have rubbed minds, heard from many doctors, those practicing at the tertiary level, secondary level, or the primary level, the maternities in our communities, the general hospitals, in our towns and all of these. Is the situation the same, or they are better, or they are worse off in all those lower levels of institutions, medical institutions?
I will even say they are worse off. You know why? If those who are highly sought after are being treated this way, you cannot imagine if a consultant will want to leave because it's not properly treated, what happens to a medical officer who could be thrown from anywhere to anywhere? As a consultant, when you are a specialist, you are ear, nose, and throat specialist, you are a general surgeon, you work within your space because you are now highly specialized and you are dealing with cases that are out of the usual. But if you are a medical officer, if you are gone today, they can decide to transfer you to Elisha tomorrow, and also all those instability are even there. For any reason, they can transfer you. They can tell you, just stay here. This is where we want you to be for now. Whether you are doing what you are supposed to do or not, if you complain, it's keeping you. So their own situation is worse. And that's why you are not finding people there. Go to all these primary and secondary healthcare levels and see whether you find doctors there. Even if you find a doctor, maybe, I don't want to say much. But the thing is, their own situation is even more critical. And those ones are the ones who are supposed to be taking up the pressure from the tertiary healthcare. They take care of basic things. Little cuts there, cesarean section at times if it's not complicated, one small appendicitis and things like that. Take care of the basic things, even resuscitation for basic things, and then send the ones they cannot handle to higher levels. But now everybody comes, even if there's you have malaria, you come to the teaching hospital and all those things and start speaking big grammars there. You understand? So you have like 120 patients waiting for one doctor within the space of 8 hours. How would that fellow be able to attend to all of them? And if he's, how will he do it appropriately? A doctor is supposed to attend to a patient for at least 40 minutes to 1 hour to be able to interact with that fellow, ask questions, examine the fellow, counsel the fellow if there's a need for counsel, prescribe things, write up some documents, document what has been found, and then prescriptions, fill some forms. But now if a patient spends more than 10 minutes with any doctor, the patient and the doctor will be cursed by those who are waiting outside. And they've been waiting since 5 a.m. This same doctor could also actually be called out of that clinic because there's another patient they admitted on the ward that is collapsing. Or he may not even report at that clinic until like 10 because he's still in theater, working on somebody. He worked over the night. So how will he be sound in the morning? But there's no replacement. And everybody's whipping up sentiment. Isha Anuni, is a humanitarian job. Who humanitarian help? Do you take humanitarian statements to the market to buy things? Or you use that to pay school fees for your children? Or that is what you pay to a bricklayer to build a house for you? Of course not. What is humanitarian? The fellow is contracting the road when he does a bad job. People will get, they will get involved in accident there. and they bring a lot of damages to us. So everything we are doing is humanitarian. People should stop blackmailing. Emotional blackmail should stop. You know, they should do the right thing. That's just it.
Yeah, doctor, it's quite instructive, because when you said averagely a doctor is supposed to spend like 30-40 minutes with the patient, and if that is tried out now, according to you, the doctor and the patient inside, you know, they'll be shouted upon, they'll be cursed and all of those things, which is the reality. Because I remember when we were much more younger, like a boy, if you are taken to hospital, in some of the teaching hospital you've talked about, you know, you have small toys on the doctor's table. They ask about your school, your haircut, the color of your eye, to make you feel relaxed. And then they ask you all these questions, you know, and then sometimes before you, that you are feeling funny at home, that your parent had to bring to the hospital, sometimes before you leave that hospital, you are feeling better, and your parent will be looking at you. What's the problem with you? You are just somehow, before you left the house, now you're in the hospital, you're feeling better. But all of those things have been eroded. Is it just about the jackpot thing, the pressure on the personnel? Because we have to talk about the quality of the doctors, the nurses as well. Because I have personal experiences in some tertiary hospitals that there was a day I went there like a couple of times, and you see that almost everybody is edgy. The nurses are angry when you ask them a question. The tone is funny. The doctor is quite like somebody in a hurry, and almost the whole system there is like they have spirit of anger on that day, and you are wondering what is really going on. Let's talk about the quality of the training, the quality of the experience being had by these doctors. Are we not losing it because on the altar of, there is pressure on the personnel, and the real quality is being eroded as well? Because I want us to balance that conversation. While we are talking about things should be well and proper for the medical health officials, how about the quality of the service that they produce?
Okay, the quality, I told you earlier on that to have good quality service, you need the man, the machine, and money. You understand? And I told you the most important, the one that manipulates the two others is actually the man. When the man is not properly placed in the scheme of things, it becomes a problem. See, in any setting, okay, a medical student who was trained for more than 8 weeks now, 82 days, in the dark. So, what do you want him to turn out to be? And when he now resumes as a doctor, there's still no power supply. He has to take his case notes close to the window. At times, he has to even come out of his consulting room because it's hot there to consult outside. Is that normal? So those are the things we are talking about. Okay, in a situation where just 38% of capital project was released as of December of a particular year that the budget should end. So what do you think they would have achieved with that, with the rate of inflation that we have now? So what would they have been able to achieve with those projects that have been carried out? See, some of us carry a lot of things to the hospital to work with, just to be satisfied, just to have fulfillment. Because when we have those cases, and you keep telling patients, come today, come tomorrow, because one equipment is down. If it is something portable and you can buy with your money, you then buy. Because you have all the time in the world. This patient is also agitating. Yeah, you've told me this. Why is it not being done? I are the one that's being fixed. The patient does not know the government, doesn't know the head of the hospital. It is you that is the doctor to that patient. So it's also putting pressure on our purses. Because at times, as a doctor, you be the one to give money out to your patient. Please don't buy. Don't waste my time any further. Because they don't even have money. And you need to save this life or do something at least to tie down things. So after doing that, is that fellow likely to be in good frame of mind? And even those people that are our clients too, they should take it easy on the few people that are left in the system. Talk to them like human beings. Try to pamper them. It is not, some people say, oh, that salary, are you not collecting salary or all those things? Okay, fine. The thing is, even when we take our car to the mechanic, there's a way we talk to them. That's why the fact that we are going to pay them. Please, let's be humane with these people. Talk to them nicely. It is wrong for you to go there and start insulting them and say, I know you don't have husband at all. Is this how you do? If somebody speaks like you, like that to you, will you take it too? They're also human and they are under so much pressure. Please talk about their homes. If you have clarification to make, please ask in polite manner. You can't shout at them and expect them to be quiet. Some people will not answer in an attempt to avoid rancor. But some people will shout back at you. We were not all brought up from the same home. So we need to be smart. We need to be careful with all these things that we do. The people in the system too. See, there is a particular, okay, let me even mention this. The Jesha people are really trying. They built the old people's home, geriatric center. They keep the place. They are doing a lot more to augment the system, to encourage people to work in the system. Some other people still should do such. Not just complain about what is happening in the system and go there and damage things that are the little things that are left there because they ask you to pay. So who are you expecting to pay? Nobody has what it takes within the system. The system is not perfect for now. So when the people go there today, they should encourage it. If you beat up the doctor and you beat up the nurses, believe you me, the next time you go there, you won't find any of them there because nobody wants to stay in an environment where his life is threatened.
Okay.
So we can only get the best in an environment where proper machines are provided, the money is there, the people are encouraged, there's motivation.
Doctor, so let's go to the budget that was just passed, that was just released, that is still in at the National Assembly last year. The health sector has been allocated 2.39 trillion naira. Is that can that do anything, or can that do something subsequent or substantial for the health sector?
Okay, let me put it this way. It is not supposed to be so. There's a percentage that was stipulated by WHO that should be the percentage of the national budget that should be devoted to health. There's a particular percentage that should be devoted to education. But in the wisdom of our leaders, they are not doing that. And like one of the CMDs said in the report I read, they said they operate the envelope system. So within the greater budget that the president had presented to the House, within the scope of the proposed IGR, internally generated revenue for the country, there's a percentage of it that would have been voted to health. So out of that total is where they would then distribute fractions and chunks to each of them to take care of their personnel budget, their capital, and their overhead. And most likely now, they expect them that their internally generated revenue, a particular percentage, will also come into the pool to fund all this. So that is the issue. They know the right thing to do. But for now, until the system is buoyant and we settle some things, even if the government is handed over to some of us, we might still find it difficult. You know, some of us have been privileged to work in certain, in close relation with certain people in government, and having the privilege to head some associations too. Places that challenge on your laps, that look, the resources are limited, but you still have to take care of so many things. Even unforeseen circumstances will occur. So those are the issues with governance. But the thing is, even with the little ones that are on ground, that's what I'm talking about. If you don't have enough resources to finance this large level, why don't you collapse a bit so that your quality will be good for the number that you can cater for? And then from there, you then work ways of expanding. But if you retain the expanse and then the resources are not adequate, the human resource, the financial resources, and the machines are not there. Another problem with the health sector is the issue of maintenance of our machines. So many of these machines are imported from other countries, and instead of our people to acquire the skills to be able to maintain them, that is not there. So technologically, the nation has to also develop, to be able to develop things to respond to the challenges technologically, and then we can maintain them in-house. That will reduce the cost. So if you want to buy a good X-ray machine now, it will cost nothing like less than 100 million naira. And that 100 million naira, by the time you use it for some time, if you don't have good maintenance, it may not last more than 2 months. Power surge, outages, all those things, despite the all sort of backup to protect it. And you may need up to like 50 million to repair it because you are going to be importing an expatriate. If there's a damaged component, they are going to import it at the rate of dollars now. It must be a contract by our rules. You know, there's what they call the Procurement Act. So that's why you ask for something today, and then you don't get anything until late months. And that will not work in the health sector.
All right.
That will not work.
But so many things to still talk about, Doctor, because some will say there is distribution issue as well. Dr. Ali Pate, rather, the Minister of Education, said recently that there is a distribution issue. It said about 55,000 licensed doctors in the country and attending to Nigerians following the mass exodus of health professionals to hospitals abroad. He said initially there is an assessment and it was discovered that we have 85,000 to 90,000 registered Nigerian doctors. But now not all of them are in the country. Some are in the diaspora in the UK, America, even Saudi Arabia. But then there is a distribution issue because he said many of them are in the cities, in Lagos, in Abuja, and few urban centers. How do we address that? You've been at the helm of affairs of the enemy in Osun before. Do we have that issue here in the state as well? All those questions and more will be answered after this break. And I'd like you to just hang in there. The program will continue after now. All right, thank you for staying with us. And we'll be talking about the health sector, the brain drain in that sector, and what the issues are and what we can do about it. We have been talking with the former chairman of the Nigerian Medical Association in Osun State, Dr. Adedapo Aditoye. He's been speaking with us virtually, bearing it all on the state of things. Thank you for staying with us, Dr. Aditoye.
Thank you very much.
All right. I was talking about distribution issue. You are in charge in this state at some point. Do we have that problem? But the distribution issue, Ilesha, the cities, Oshogbo, Ile-Ife, is it the same way that we have the spread in Ikirun, in Ede, in Ilajue, somewhere in Ilaorogu and other, villages and communities? Is that really an issue? Because the minister raised it. And did you have that issue while you were in charge here?
Okay, that definitely should be the situation. Though I cannot provide you with data to support that. The Osun State is even a bit lucky in the sense that you have a teaching hospital in Oshogbo, and you have a general hospital in Oshogbo. Then you have a teaching hospital that has arms, the OETC. The headquarters is in Ife. There's Wesley Guild Hospital in Ilesha, and it has some other arms. But the other major towns and villages, they will definitely be at the mercy of some other health workers that are, as per skill, less compared with the doctors. Because like I told you, the arm of our association that, those who work under the state, doctors who work under the state belong to, that arm is almost depleted. As of the last time I interfaced with them, they were less than 50. And that was almost 2 years ago. We had a meeting and they were quoting figures to me. And so many of them are even in administrative positions. Some of them would have retired between then and now. So they will be left at the mercy.
All right, we'll try and get it right, with the connection, and we are taking it over, after now. My next question to him, and I hope he can get back with us quickly, is this special status. It will appear like to ordinary or other professionals, like the doctors are looking for a special status, that they should be treated in a special way, kind of. But somebody will say, I'm an engineer and I'm doing well and I'm equally qualified and I'm doing the best. I'm a professional. Why should somebody of other profession be given a special status? Okay. Dr. Aditoye, are you with us now?
Yes, I am.
All right. Because of time, let me just go to my next question. Somebody will say, the way you have been speaking and other doctors have been speaking, either through the NMA, the MDCAN, all of these other bodies, will say, do you mean that the doctors should be given a special status or a special treatment among all the professionals. And I'll give you an instance. An engineer might say, I've worked my socks off to reach where I am and providing a very great service, you know, either in the public sector or in the private sector. A teacher will say the same thing, possibly a farmer as well, and all other providers, security agencies as well. We say we are providing essential service. And just of recent, there is this report that came out. It's still on this matter. In fact, it's from Dr. Emeka Ayogu, the chairman of the NMA at the FCT, who said, judicial officers have just gotten an increase on remuneration. They are being treated well. Members of the armed forces are being treated well. How about the medical doctors? And I just will say, wait a minute. Why should a Nigerian medical doctor or that profession be given a special status? Why can't the system just treat everybody well?
Okay. Well, treating everybody well is what we've been asking for. But still, anywhere, any developed country in the world will have specialized area of request. If you are an engineer, if you were an engineer, all engineers don't earn the same thing. Those who work in the oil industry, because I should say that things like that, area of specialization, they earn more. They earn more, and we all know that. So even the judiciary, they don't earn the same thing. In UK, there are people there who, for the doctors, they don't even earn the same thing. It depends on your specialty and what you bring in. So they have a way of doing things. No hands blanket wages anywhere in the world. What people do is that they pay you as your input is. Give your salary. If your input is not good, if you agree. So all those things are there. So there's nothing like, do they want to be treated specially? Let's not treat them specially. And see if they will not go where they will be treated specially. I just told you now that people are resigning from government job and going to private settings. You understand? It's a matter of what and whatever. See, there's nothing like equality in the world. We only have equity. You get what you deserve. Even in places where people are of the same brand, they graduated the same day. They don't earn the same thing in the banking industry and so on and so forth. What you bring in, your quality, what you're able to deliver, what we get from your engagement with customers or clients will determine what you are paid. So let's forget about the word specially or whatever. See, people deserve what they deserve. There are motor mechanics, there are people who collect 80,000 naira for just touching your electrical system, and what you'll be running around for past 2 months will be sorted in 1 hour, and you will collect that much. And there are some people who sit with your car from morning till evening, and you barely give them 3,000 naira because they don't know what. Sorry, let me not say that. So, but the thing is this: let's forget about being treated specially or not. They need to treat some people specially. That's the fact. Why is the governor not riding on the Corolla? Why is he riding on the Jeep? Why is the president riding armored vehicles? Why are we buying 160 million worth of car for House of Rep and Senate members? Are they not Nigerians? They don't live amongst us. Why are they earning much more?
Sorry, Doctor.
So please, let's forget about
if I may butt in here before my colleague Uzams comes in, very quickly. Now we have got talking about getting it right. We have identified the issues, and you have, been providing solutions as you have been identifying the issues as well. But now to be more categorical, there are challenges all over the world. Yes, we know, and even in health, because those countries that are opening their doors for doctors is because they identify some challenges. That's why they open their doors to say, guys, come in, skilled workers to come and fill that particular system. Now, here, most of the times, health ministers, so let's talk about governance now, have been doctors and doctors. There was a time, it should have been this profession, it should have been that profession. So from Ali Pate to other persons before now, Oloruni Bemamura, all of those guys, even if they are politicians at some point, they have been medical doctors. So they should understand. At some point, some of them practice. So what is the issue? You have doctors who were once practitioners now holding the aim of affairs as ministers in the health sector, we are still having these challenges. Shouldn't you be asking yourselves questions?
Okay. That is not the way to look at it. The issue, I just told you a moment ago that the issue of governance is not like what we think. Presently, we have a lawyer as the Honorable Commissioner for Health in Osun State,
Okay.
and we are working closely with him. You understand? The thing is, his ministry has been able to achieve a lot, but can his ministry manufacture doctors? If the state government...
No, Doctor, I was talking about policies and having somebody that understands the terrain. Please go ahead, sir.
Hear me?
Yes, I can hear you. Please go ahead.
Okay. If the budget does not cover certain things, it cannot achieve them. I told you earlier on that there is a percentage that should go to health of the total budget of a nation. But if that does not go to that fellow, no matter how good your plans are, these CMDs that are complaining, are they not there? Do they not have the way with that? They grew up within that system. They rose to that level within that system. So they know the problems of the system. But when the laws of the land on how they should act, you know, CMD can't even take out of the personnel budget to take care of capital issues if they occur. That is the misappropriation, and you go to jail. So these are the issues at hand. It's not about who is at the end of our affairs. We've had non-doctors, non-physicians, you know, at the end of affairs as health ministers in this nation. And then we've had people who had very good, brilliant outings because they had the support of the government. The government then pumped money. Look at the Olukore and some pity. He did it under Babangida's administration, and because he had the heads of Babangida then, and money was flowing, he could achieve a lot at the primary health care level and things like that. So in the certain years in the 70s, there was Indoji for everybody, though there will be relativity too. So, and people enjoy it. So it all depends on the state of the nation. For you to be able to increase salaries and do all those within the system also needs to prosper. So, and people were warned before the system went down to on this way, but nobody was showing interest. So that's all. Maybe the interest was not enough. Let me put it that way.
Okay.
So that I won't be castigating anyone, because I know people are trying their best.
Doctor, so we'll keep talking for the betterment of everyone in the country. So we're trying to get it right. We're trying to actually know what we can do to have a better Nigeria. So you said earlier about WHO and the percentage given to countries for the health sector. Could you expatiate a little on that? Okay.
Let me put it this way. I am not too sure now. I know for education it should be about 25% or so. For health it should be about 12 point something percent. I think it was increased recently. So of the total budget for the nation.
Okay.
But we have not gotten there. You understand? So, and you can only plan, come to think of it, our country too is a bit very interesting in the sense that we have a lot of sentiment working for us or against us. When we want to distribute wealth, we keep talking about tribes, religion, all those things, which will not happen in some other tribes. It's making life a bit difficult.
Okay.
But despite that, you will see that some private settings are thriving in this nation because there's a chain of command that is very apt. Unlike the government setting where a lot of, I don't want to call it intrusion, in the sense that some people who are even coming up with ideas, they are not too sure of what they are saying. And they're a bit far from the grassroots, so they don't know what is going on there.
Okay, so you, just like you said now, you said the private sector is doing better than the government sector. So do we really need, should I say, a new leaders or a change in the leaders of the health sector?
No, see, even most of the private settings are being run by those who came from the public. Check out most of the private universities we have in Nigeria. The professors who are becoming the vice chancellors were invited from public institutions. But it's the will. The political will is there. If it is owned by a mission, the mission is pumping money. You know, at the snap of their fingers, this needs to be sorted out. It's sorted. If you permit me to mention institutions, look at somewhere like Babcock Teaching Hospital in the bush. I was there for an accreditation visit and I was asking them, where did you prepare so that we could visit them? They said, enter anywhere. You understand? They weren't restricting us. Enter anywhere. Tell us if there are deficits. We are ready to fill them up in no distant time. And we could barely not find any deficit. You know, they have more than enough. Their system is running because it's private. So, but in government sector, I just told you now, you can't take money from allotted to A to respond to B, even if somebody is dying. Because that will be misappropriation of funds. And if that law is activated against you, you will be jailed. So
Doctor,
there are a lot
you
of
are
handicaps in the
government,
system.
yeah, government bureaucracy and some of these bottlenecks. It's a big issue.
It's too much. It's too much. So it's making those who have the expertise, who have the knowledge, who have good wishes when they were trying to become the head of institutions, is making them to be handicapped. So many institutions now, they are only surviving on support from alumni. I mean, even the universities. You will see this laboratory renovated by the alumni set of so year. You see this equipment, even when some institutions want to have the accreditation visit, what they do is contact the alumni, and those people will contribute money. And these are the people who are saying Japa. Because who will you contact in Nigeria that will give you money? The fellow who could not fuel his car. You understand? Those are the people who contact. Eventually, they send, we need a...
Permit me, because we are taking it home, like 3 questions now. These bottlenecks, bottlenecks and this bureaucracy thing, some will say initially, those things that, you know, because he has to pass through table this and table that, and all of those things are put there to, you know, forestall or prevent corruption in the first place. That maybe those who had that plan had a good intention, but now it's become a challenge. How do we navigate that part?
Well, that is not within our scope, or else you'll be seeing doctors as overbearing again. You understand? The situation at the ministries and other parastatals that are governing the system is beyond us. You understand? So you can't talk much about that because you don't understand how they run perfectly. Right. They then tell you are not an administrator. Yeah. But the same me, who is not an administrator, will administer a private setting and it will be successful. Are you not?
All right.
Is it not funny?
Some persons have said that, you know, and there have been calls, by the way, not just now under Bola Ahmed Tinubu's administration, even under Buhari as well, and other leaders, even at the state levels, to say, yes, you are in charge of NMA, maybe, I don't know, at the national level, you must still have that ambition, but as a Nigerian, actually, who is a medical doctor, that we should have a legislation that will forbid public office holders from seeking medical care abroad. We are not talking about rich men here. We are not talking about businessmen or people who will pay for whatever service in any part of the world from their own pocket. We are talking about public office holders who are being taken care of by people's patrimony. That there should be a legislation that should be pushed for, that should prevent and forbid them and make it a criminal act if you are holding a public office and you are seeking medical attention abroad, that if this is done, I will get ahead with this, I don't know how, that it will force leaders to, you know, invest by policy, by training, by infrastructure, by funding, because if they know the CNC will use that medical facility, the vice president, the first lady, the governor, the commissioners will use that same thing in their domain, they will be forced to equip it and to do what is necessary and to attract the best of brains. Do you agree with that assertion? Because some have said the choice to who takes care of me is my prerogative.
Yeah. I agree up to 95%, but laws are not made that tight because of exigencies. But in good countries, let me cite the example of India. About 30 years or about 35 years ago, a president came in India and then said no to anything that India cannot produce. If you own all these gadgets and they are no longer functional, break them down. Let's see what we can do about them. And the ones we can't do, we import them as spare parts and we complete with them. And that's what gave birth to Tata vehicles and all those things. And as of the last time I visited India, any vehicle that is not at least assembled in India will not be driven in India. It's not only in the sector. They make the best of shoes. They've gone far in terms of technology, despite their number. In fact, these are our tricycle. They make a lot of them, like almost 90% of the ones we are importing. Bajaj, all these things are made by them. You understand? And they are improving because they gave room to that. But Nigerians are patient with their leaders. Maybe that's a question for another day. So the leadership too should do that. Nobody should compel you to do this. Because one thing is, who are the people who are going to pass this bill that will prohibit public office holders? Are they not the public office holders whose family will enjoy a lot of largesse because they want to seek medical attention elsewhere? They know what they are doing. They have their own problems as well. But I keep saying that the problem of Nigeria is not leadership, it is followership. If you have good followers,
how do you mean?
If I have good trainees behind me now, if I have good trainees behind me, in case I exit my position, any one of them that comes in, I won't be scared. It will be wrong for me to be ill now and I can't attend somebody I trained to attend to me. Then there's a problem. But can the Nigerian engineer allow his younger one that he trained to come and take care of his car or the electrical wiring of his house and things like that? Of course not. So that's where the problem is. If you don't solve the problem of fellowship, if you don't have a plan before getting there, the plans are not going to fall on your laps. So we should develop the followers first.
Doctor,
so that when it is going to become leaders, it will work.
We are rounding off. Although some might not want to agree to say the issue with Nigeria at all level is the followership. We understand. Or some might say everything runs from the head. Is that not a simplistic way to look at it?
No, look at this thing. If the children of a particular home, they don't have what it takes, one day their father will leave by way of death or incapacitation or whatever. One of them will have to take over that role and lead the home. And if he has not been well groomed, then there's a problem. But when we give leading a leadership, that leader cannot last forever. Any president in Nigeria will last there for 8 years at most.
All right.
What happens after 8 years?
All right.
So that's the thing.
Finally, the issue of quackery has been an issue because sometimes you see some arrests here and there, some persons who impersonate to say they are this and that when they are not. How much of a problem is quackery in Nigeria or in Osun State? Is it really an issue for
problem? Quackery is a major problem, my brother, and the whole nation. But one thing is this: why will people not slip into this space when you don't have the people who are supposed to do their job available to you? There's no amount of, quackery is a major problem. The people themselves who are submitting themselves to quacks, there's little or nothing you can do about that. If people don't know their boundaries and the law is not taking its course, thank God you mentioned that there have been arrests here and there. So what became of those arrests? How many people have been convicted? When you arrest somebody that he has inadvertently killed because he's a quack, and the people in that town, they are saying, free him, he's our doctor, even when he has not gone beyond secondary school. So what do? And the government can't stand a ground and say, no, this has to stop. Is it me as a doctor or the leadership of NMA that will now go and say, no, he must be jailed? We are not lawyers. We can't go beyond our bounds. This fellow has been identified and he should be put through the process of law to either vindicate him or, but no, it doesn't happen that way.
Yeah.
So a lot has to be done. The people themselves who are being served, as I am, I will ask for the details of a particular roadside mechanic before giving him the opportunity of working on my car. I won't just be, so not to talk of your life.
All right.
But people enjoy those things. They want to be in control. They want to be where they'll be the one dictating what to do. Give me an injection. I don't want tablet. But you can't do that with a doctor. So that's the problem. All
right. And I'll take it as your part in short. The NMA, all of these professional bodies, the subset of the NMA, the ARD, MDCAN, and all of them, even the NMA, the parent body, and these doctor professionals, is there anything they can do about this medical jackpine, or they are accomplices in the matter, or they are helpless?
No, there's nothing they can do about it. They make proposals to government. They've done a lot. Make proposals to government. This is what step you can take. And you see that people will stay. Nobody wants to leave his family. You can imagine somebody in Japan now. He makes money and sends it to the mother, or the mother breaks down here. You can't be present. Even if your parent dies, you can't be there for the funeral. Nobody enjoys that. You have loneliness, all sorts of things. You depart from your culture and all those things. But there are prices people have to pay because they are based. Till the Yorubas will have a saying that you understand? If you know, so the people have to survive.
All right.
They have to play their roles. Instead of you staying back here and facing shame, the people in your children's schools are now sending terrible messages to you that you, as a trained medical doctor, consultant in this nation, you can't pay school fees for 2 children that you have. You are not having 6. So
but doctor, are we not exaggerating by that? Is that the real position of things, that a consultant will be having issues with school fees?
Oh my goodness. Okay, you know the interesting thing is it's usually difficult for people to believe that doctors can be in such circumstances, but they are. I know friends who had to borrow money before leaving this country. They were owing banks, but now they've overcome all that just because of Japan.
All right.
You can imagine being paid like $6,000 in a month. So you'll be able to offset whatever.
So somebody will say there are challenges everywhere, but then this morning focus is about the health.
People can talk about. I'm a doctor. I'm not a cocoa farmer.
I understand.
I'm not an engineer. So I want to talk about what I understand.
All right.
So they should solve their own problems.
All right.
We should solve our problems so that the nation can be peaceful.
Exactly. And we'll keep having this conversation till we get it right, because Nigeria must prosper.
We appreciate it.
Thank you very much, former NMA chairman in Ocean State.
Thank you, Nigeria.
And of course, Dr. Adedapo Adetoye. Even when you said you are not a cocoa farmer, your white kaftan is making you to look like a one top businessman there, and you are looking all glowing. Thank you for your time.
We have to
all right. Thank you very much. Enjoy the rest of your day, sir. All right. That will be
that was quite topic today.
Yeah, because it's health is wealth.
Health is wealth.
We can't manage it. We can't panabate it. You must just get it right.
Yes, we can't pet the situation.
That's it. You might want to panabate situations, but not about your health. Because if it appears like you are getting it right now and you have not done the right thing, by the time the consequences come, it might be fatal, and nobody wants that.
Yeah, nobody wants that. Yeah, we're going already. I remain Uzom Sokichiku. Stay safe.
And of course, I remain Emiojo, using our words. Please, you can have a recap of our program, this particular, robust edition, on our YouTube channel at Western Spring Television, and all the exciting editions of this program and other programs from this station, where we see it as it is on Western Spring Television on channel 190 on StarTimes TTT. Shout out to the production team for a great job. We will be back for the TGIF edition tomorrow.
Right.
Enjoy the rest of your day, and please take care of your health. Health is well.